Based on a cross study of almost 6,000 men, 21% of men over the age of 40 have experienced some sort of erectile dysfunction. In the United States, 30% of sexually active men ages 57 to 64 have reported experiencing erectile dysfunction in the past 12 months. These statistics are staggering. This is a deeply personal and important area of a man's life. There are a lot of different triggers and reasons that people might experience erectile dysfunction, including psychological triggers such as stress, depression, performance anxiety, marital difficulties, and financial difficulties. There are organic triggers like arterial and vascular problems such as atherosclerosis, diabetes, radiation therapy, tobacco use, and hyperlipidemia. There are neurological triggers like diabetes, alcohol abuse, MS, Parkinson's disease, spina bifida, brain and spinal cord trauma, pelvic fracture, radiation therapy, and pelvic surgeries. There are endocrine reasons such as low testosterone and different pituitary issues, and there are medication-induced and other chronic medical diseases like kidney disease and liver disease and heart disease. These issues need a comprehensive evaluation and a holistic approach that seeks out what are those root causes. How do erections work? First, there is some sort of stimulation trigger that leads to the release of nitric oxide, which is the main neurotransmitter that mediates a penile erection. This comes from the endothelial cells and from the parasympathetic nerves. That leads to a signaling cascade that includes guanylate cyclase, which leads to the formation of 3,5-cycloguanosine monophosphate in the cavernous tissue. This leads to a relaxation of the cavernosal smooth muscle by decreasing the amount of calcium allowed into the cell, which leads to engorging of the corporal tissue with blood and the compression of the subtunical small veins. It turns out that also the muscles in the pelvic floor also help keep the engorgement possible. So it's a complex interplay of neurological signaling, the psychological relaxation, your cardiovascular system, and your pelvic floor muscular strength and health.
All right, me and my sweetie are going camping this weekend. Let's see if we can get this tent all set up.
Hi, honey. How's it going pitching that tent?
Hi, my sweet.
Oh, mwah.
So good to see you. Honey, I'm having a really hard time pinching this tent. Please help me. I'm so frustrated.
You should be able to pitch a tent.
I know, and I can't.
I read this study recently, though.
Tell me about it, sweetheart.
So it's super exciting.
Tell
So
me.
they took men and they hooked them up to this blood pressure cuff thing, and they checked for electrical stimulation because they had this hypothesis that it's not just a vascular problem that's going on. I mean, I know that with your diabetes and your hypertension, I mean, it's common that people have vascular related erectile dysfunction. But in this case, their hypothesis is also the pelvic floor muscles, like muscles you use to squeeze with up there.
Oh, sweetie.
So they were checking the strength of those muscles, and they did a bunch of sessions with these men to try to increase the strength of the erectile with the electrical stimulation.
So you're saying I need to have something hooked up to me to get an erection?
Well, in this particular study, this is what they were doing, but what they did find is that if you strengthen the pelvic floor muscles, there was like an 80% increase in overall erectile strength and rigidity.
Sweetheart, what are those things that you do all the time?
Well, in my women's group, we learn all about this, and so some of the things that women do is when you're urinating, you can stop the stream midstream. I'm doing it right now. I'm pulling up on the muscles.
Oh, honey.
So you can just squeeze up on the muscles, and that'll make them a little stronger. Yeah, like that. Do it like that. Yep,
Oh,
exactly.
wow.
Exactly. And so those will help improve the strength of the whole pelvic floor.